Thanks, Sean. All right. So when you actually are going to do the procedure in lab or in the comp, you want to have everything ready before you even call your patient back. So this is the box that this monitor is in. This is the old one, and I'll show you what this looks like afterwards. It's super, super old. It's fun. That's Mini Bertha. That's her name. This is just regular Holter monitor. So we want to make sure that we have all our equipment. Our case, shoulder strap, our monitor, our lead wires, alcohol, our little brush to abrade the skin, shave if the patient's hairy. We need tape and our 5 electrodes. You are going to take tape, you want 10 of them, 10 strips, okay? When you're in lab, just do 2 or 4 pieces of tape just to save on supplies, but when you actually do your comp, you're going to make sure that you have 10. Usually, Kathy or whoever's doing your comp will have you stop doing stress loops and taping your whole patient just to save time. But prepare just in case they make you go over, okay? Then you want to make sure you have your activity diary for the patient, okay? And you usually already have this filled out with their name, medical record number, and the date on there, okay? So, and now I have everything ready. I want to make sure that my batteries are good and the discs are in there, and then I turn it on. Oh yeah, it's working. Batteries are dead, it doesn't work, okay? But we go, oh yeah, it does, to make sure, all right? If it doesn't work, then we get new batteries, right, in real life? So we pretend batteries are good, and we turned it on, and we tested it. It's all good. So the reason we test it before we hook it to the patient, because if we have them all taped up with electrodes, and then we put it on, and we turn it on, and then it doesn't work, now we have to troubleshoot why the patient's there. It's not really fair for the patient. So I'm going to call in my patient. So I'm going to sanitize my hands, right? Number 1. Hello, Anthony. How are you today?
I'm all right.
All right. I am Tammy. I'm your medical assistant. I'm going to hook you up for a 24-hour Holter monitor. Have you ever had one of those done? No. Okay. Can you verify your name and date of birth for me?
Anthony, 7/24/90.
That's my patient because that's my chart. Okay. All right. Well, you've been having some palpitations, whatever symptom they've been having, right? Okay. You already read the chart. So you've been having some palpitation. Doctor wants you to wear a 24-hour Holter monitor. It's like the EKG we did in the office, but you're going to wear it for 24 hours.
Okay.
I'm going to put those electrodes on you, but 5 of them this time.
Okay.
They're just like those sticky tabs. And then I'm going to hook you up to some wires, and then explain the patient diary to you, and then send you on your way.
Okay.
Okay? So I am going to have you get undressed from the waist up.
Okay.
And here's a gown. Make sure you have a gown. And you can put the opening of the gown in the front if you choose to wear that. And I will step out.
Okay.
Let me know when you're ready. All right?
You want me at this table?
Nope, you can just stand up.
Oh, okay.
The thing is with, the book says to have the patient sit, but the reason I don't have my patient sit, you can have the patient sit on the table until you come back in. I don't have my patient sit when they have the Holter monitor being hooked up, because what happens when you sit? Does everybody have perfect posture like him? No. All right, what happens? Everything goes like this, right? So when I sit, I have this nice bulge right there. So it's harder to feel the ribs and to put the electrodes on. So if your patient is able to stand for a short period of time, then I have my patient stand, okay? Are you ready?
Yep.
All right. Then have you stand up. Are you comfortable standing?
That's fine.
Okay. I am going to prepare your skin. And the reason we prepare your skin is so we don't want those electrodes to fall off, because you are going to be sleeping in them.
Okay.
And I do want to ensure that you don't touch the electrodes or the wires once I place them.
All right.
Okay? Alcohol. Alcohol the areas of the skin. Okay? We just pretend in class, because if we keep doing alcohol on you, you start getting some rashes, okay? Because these really stick good.
Thanks.
All right? We're going to alcohol, then abrade, okay? We never want to abrade and then put alcohol on there, because what's going to happen?
It's going to burn.
It's going to burn, all right? So I go alcohol here, 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 okay? I don't do this, right? You don't do that. You let it dry. By the time you're done doing these 4, this one should be dry. And then you abrade the skin, and we pretend, okay, we don't want to hurt our fellow students, but in real life we're going to actually really abrade the skin. The reason we abrade the skin is so these electrodes stick good. And that's something verbally that you actually have to say in that comp, okay? Don't be prompted, why are you doing that? State it, I'm gonna abrade the skin so the electrodes stick well. So you abrade, here, I'm done. He's not really that hairy, okay? Where I'm gonna place them, I'm gonna put these here and then one right there. I'm really not gonna wanna shave him. I'm gonna show you how to part the hair so it sticks a little bit better, okay? So, I have these, they have snaps on them, okay? If I put those electrodes on and then I try to push these on, is that gonna hurt? All right, look at this. That's gonna be his skin, how it indented. So as I put them on, I'm going to snap them. All right, first one I like to start with is red. Why red? Right in the middle there, right? So I'm going to snap it on there. All right, I'm gonna put the first one on there. I'm going to move your hair here. There's a little tab here. Do you see that? All right, it has a little cut there. Leave that on there. Don't peel that off and stick it to the patient's chest, because it's easy to grab this and peel it back off when they come back. Instead of trying to go like that with your nail, it's gonna hurt. So you're gonna peel just like that. That spongy part is the electrolyte. All right, we don't want to touch any of that. That's why we have that little tab there. So best way, you hold it like that. So I'm gonna go this way, and I'm gonna press right there. I'm going to move around, lightly push there. If I push too hard, I just squished all the electrolyte out, and I'm not going to get a good read. So go around, gently push there, all right? And remember, it goes, the left will be, the first color would be brown, because on the left, it will go, think of your shading, brown and then black, okay? Can I do the right side first if I wanted? Yes. Okay.
Make sure you do the right colors.
Exactly. And then pick that up later. All right. Can I still palpate to feel, even though I abraded the skin? Yes, because it's not going to be sterile. All right. There, black's going to go right there. It's important to keep these from not being tangled. All right. Thank you. You're such a good patient. You're just moving before I tell you. And then what comes first? White or green?
White.
White is in the sky, and white is on the right. Okay. So there. And our last one, green, and green is what?
Ground.
The ground. What is the ground for the EKG?
Right leg.
Right leg. What color is the electrode? Green. It is green. Alrighty. Turn around. Alright, so I have here, well, can I move these up if I wanted? It would still be right, okay? If I had them any lower, it would be wrong, because they're still on his rib. I want to stay on his rib, okay? So I could be higher and I could be lower. I stayed lower because I don't want to, when you sit down, you kind of do, you don't want them to go up, right? He's thin, but think of your patients that are a little bit bigger. When you sit down, what it kind of folds in, so think of that, all right? I'm serious? So, now I'm going to let this drop, okay? It's okay to let it drop. I'm going to drop that. Now, are you right-handed or left-handed?
Right-handed.
You are right-handed. So
But I can use both.
Okay.
But for the sake of right-handed.
All right, so I'm going to put this on your right side.
Okay.
All right. So I want the pouch to be on his right side so he can use the right hand to hit the event marker. So I'm going to actually, would you like to put this over your head?
Sure.
All right, there.
So what? That's
There, just like that. Is that comfortable for you?
Yeah.
All righty. Now I can bend down, pick this up. This is very easy. Who has put cable in their TV? All right, so you have, it's the same thing. You put it on there, let the prongs fit, and then screw it on there. Okay, that's how it's going to be. The event marker is that black little button. You always want that facing out. The reason we want it facing out is because it's easier for the patient to push it. If it's backwards, they're hitting this first and trying to push. So if we have it in the front, then it's perfect, it's easy. We're gonna slip this in here. There you go. This is your event marker, okay? This is very important. When you're having a symptom, I want you to push that momentarily, okay? Just like that, perfect. Have them demonstrate it for you, okay? And then you can show them. All right, we are not done. We have to do some stress loops, okay? And we want to tape each electrode with one piece of tape over each electrode, so it gives us more of an insurance that it's not gonna fall off. That's why we have this tape here. So we're just gonna do one for you. I'm not gonna do the top one because it has more hair. I know, look at Sean. Did you see him? He just went, he's like, damn.
Well, it's alright, you should have seen EKGs last week, but we're all good.
We're gonna do white over here. All right, so we're gonna do one over. So each electrode would look like this, okay? One over there. Now we put a tape over each electrode to make sure that if we pull this, it gives it a little more reassurance that it's not gonna fall off. Then we're gonna do a stress loop. Each one of these would have a stress loop. A stress loop is taking the wire and making a loop like that and taping it, okay? In real life, we would make sure that it really sticks, but just happily get on there, okay? Just because the reason we do this is because if this wire pulls, what's happening? It's pulling here and not pulling right away off of the electrode. So your stress loop is make a loop. They can be tiny loops, and it also shortens up the wires that are hanging. Okay, so there is your stress loop. We would do that on all 5, but when you're in lab, just do one for me, 1 or 2, so we can take a look at that. So now my patient is ready to go ahead and you can get dressed, pretend that he's dressed now. All right, and then you come back in and you explain the diary. The reason you explain the diary after they're already hooked up, they're gonna listen and pay attention. If you're doing this and telling them what they can and cannot do, they're watching you and not comprehending you saying you can do this, do that, and not really having a visual of what this is. So when they're dressed, you're ready, you turn down the machine for them, and you document start time is 3:15 right there and the date, and you're going to return tomorrow at say 3:30 just to have 15 minutes for time to make sure he really gets that 24 hours. All right, this is your patient diary. I started it at 3:15. You're going to come back tomorrow at 3:30 is your appointment, and we'll remove this.
Okay.
This is your patient diary. It's very important that you record all your physical activity and all your emotion states in this. How you fill this out is you write the time, your activity. Whenever you change an activity, you have to document that. So if you're doing laundry and you have some symptoms, you're going to press the event marker like I showed you before. And then you're going to write what symptom that you had. If you change activity, you're done with the laundry and you're watching TV, you're going to document that. You also have to document when you use the restroom and if you have any symptoms while doing that. These directions are also written all here, so you can read over them. You want to record if you have any sexual intercourse, just in case you have, that's when you're occurring with your dysrhythmia. It's actually okay. All right, and do you have any questions on filling this out?
Nope.
All right, if you do, you can give the office a call.
Okay.
That's yours. And then your patient's gonna leave. You're gonna sanitize your hands, and you're going to chart what you just told them. All right, that's your whole thing. There you go. All right, sound good? You guys have questions? No?